This is Katherine, and we're finding some problem up in this region and through here. And I'm going to go ahead and muscle test supraspinatus, which you remember comes deep underneath here and comes to the tip of the shoulder right here. So to test that, I'm going to have her hold her arm out, and we're going to be pushing right towards her knee, and she'll resist. So resist. Okay, and that's difficult for her to resist. And we're just going to show the other side, and should be nice and strong, and it is. Okay, now next is touching on the stellate area. So if you'll turn here, and we're going to look up. So stellate region is right there. The stellate ganglion relates to that T1, T2 area and through the shoulder. So your patients with chronic shoulder and neck stress tension will usually benefit. So what we're going to do is we're going to press and hold against that. And one of the things that you'll see many times is that blanching, kind of a severe blanching that we see. So we're going to go ahead and press against that, and then we're going to re-muscle test that supraspinatus. And it shows very strong at that point. Okay, and then she'll keep your head turned. The other place that can really affect is GB21, which is on the shoulder region here. And as I press into there and put pressure, let's see, not strong, right there. So it's just a little bit lateral to GB21 for her, but a nice improvement in strength. So we're going to go ahead and show you the Pionex treatment for both of these. All right. Okay, so a bit of swabbing on the ear right here. And you remember Pionex has a tiny little needle in it, so most people can tolerate this, some people cannot, and that's when we'll usually use the vicarious seed. And I want to get it just on that edge of that area right there for stellate. And then we're just going to reconfirm that that was the right position. Don't let me push to your knee. And excellent, excellent. Now the other area that we found was just a little bit lateral to GB21 right here. And you can actually feel a pretty good spasm occurring right in there. And so we're going to do the Pionex right there. And this works equally well for strengthening up that supraspinatus. So all of your patients with that chronic problem there will do wonders. Really nice improvements when we see that. They don't have to stimulate. If it's a Pionex, it'll just stimulate all day and all evening long. All right. Okay, and that's great. Thank you, Katherine.